All right, good morning, everybody. Today I'm going to cover lymph and immunity to kind of help you prepare for the exam this week. A couple things to know. Remember, if you took the hematology exam last week, then you're going to get just a lymph and immunity specific exam. But if you decided to skip the hematology exam last week, then you'll have a combined hematology, lymph, and immunity section. Um, Take a look at the hematology focus session if you want to prepare for that one. But for this one, I'll focus specifically on lymph and immunity. So what is lymph? If you were here for our lecture yesterday, basically what lymph is, it's fluid that comes off of our blood vessels, and this lymph is able to essentially take a sample of our blood and move it through the body to primarily help the immune system detect any kind of infections or illness, pathogens, that kind of thing. Um, so what lymph will do is it'll move up towards your left and right subclavian veins. And it does so by movement. So you moving around will move lymph around. And so if you're nice and active, you'll be able to detect, your body will be able to detect pathogens and illnesses much sooner than if you just kind of sit around and not move around much. The biggest thing to remember for lymph when we talk about the exam, Dr. Curley brought this up yesterday, but essentially the flow of lymph, understanding that we go um, basically understanding that the lymph is kind of divided into two sections. So you'll have your um, right lymphatic duct, which primarily is involved with the right arm, um, upper torso, abdomen area, and then the right side of the head. And then the thoracic duct will get lymph from both legs, your abdomen, the left torso, left arm, left side of the head. Um, Dr. Curley covered this yesterday, kind of knowing the flow of the tracing, if you will, of the lymph. So take a look at that in your notes. The biggest thing to remember is that we drain into the left and right subclavian veins. Specifically, the right lymphatic duct drains into the right subclavian vein, and the thoracic duct drains into the left subclavian vein. So tomorrow, or for your exam, if you get a question asking you about, hey, where does lymph in the right leg drain into, just remember that the right side of the right lower body will still go to the thoracic duct and drain into the left subclavian vein, but the right upper portion of your body gets drained into the right lymphatic duct, uh, from the right lymphatic duct into the right subclavian vein. Another thing that we mentioned yesterday was lacteals. The only thing you really have to remember about lacteals is that they're involved in lipid absorption. So they actually absorb all of our macro fat nutrients, um, whereas everything else in our body is typically absorbed through the small intestines. And then another thing to remember for this one is the lymph node. So a lymph node is essentially what I called it as is the TSA of your body. Excuse me. So you have a lot of different lymph nodes circulated throughout your lymphatic system. You'll have different lymph vessels draining into it, but only one vessel leaving the lymph node. What happens inside the lymph node is that you have some of your immune cells kind of screening, kind of like TSA. They screen every cell or every protein or any cell part that's in the lymph, and it'll screen it trying to find any kind of pathogen or pieces of a pathogen that should not be there. When you have an infection and the lymph catches it, the lymph node can kind of swell up. It'll kind of close off its the flow out of the lymph node, and then the immune cells can actually start attacking and destroying um, the infection or whatever microbe that got into the lymph node, which is why it causes it to swell. As cells die or as microbes die, their cell parts kind of get left over, and they kind of just start bulging um, into the body as it's trying to kill everything. And that's why one of the best signs of infection could be checking your lymph nodes. The primary ones you might get around your neck area. You can kind of see them over here. You also have some in your armpits and arms. Um, so you can use that to kind of see if, if you're feeling a little woozy, a little sick, and you feel that your lymph nodes are swelling. Typically, that's a good sign that you are currently fighting an infection. Maybe not to the point where you're feeling, uh, you know, really, really tired or having a high fever or anything, but just know that your body is actively fighting something at that point, at that time. But for the most part, this chapter, you'll have a few things on lymph, but primarily we'll focus on the immunity and immune cells portion. Okay, first thing I want to cover is the signs of inflammation. So there are technically five signs, even though we really only cover four signs in this class. The signs are rubor, calor, dolor, and tumor, which translates to redness, heat, or warmth, pain, and then swelling. And then functio lacea is essentially, uh, or sorry, laesa is a loss of function. So if you have long-term inflammation in like joints or in certain parts of the body, um, it could potentially cause you to lose the function of that body part or that spot in the body where you had inflammation. Um, the way example I used yesterday for the class is if you've had a flu shot or had a family member have a flu shot, you've recalled people saying that, oh, I get the flu shot and I feel sick. It must be giving me the flu. It's not actually giving you the flu. What you are feeling though is a sign of inflammation. So the injury, in this case, the needle that you're getting injected with, causes this rupture in your skin. Because you have that foreign object entering the body, inflammation is one of the ways our body can help slow down foreign invaders or pathogens and give our immune system a chance to actually combat it before it becomes a widespread issue in the body. In this case, the puncture that you have from the needle will trigger this inflammation. And then what a vaccine will have, like the flu shot, it'll have pieces like protein parts of different types of influenza viruses, and it kind of deposits it in your tissue. Oh, let's assume that it's these little red dots. And then the immune system, because it doesn't discriminate, thinks that those protein parts are actual pathogens and it's going to attack it accordingly. So you're going to have the redness. Um, that's mostly due from vasodilation. So what happens is your blood cells, to help get immune cells to an area faster, will start expanding. This allows your white blood cells to kind of um, travel through the arteries and veins to get to the site of illness. The blood vessels have expanded enough to where they actually become a little bit porous. So it allows some of these white blood cells to actually squeeze out of our blood cells or of our veins to then get to the site of infection. Um, the pain typically happens with pressure. So the swelling is like an accumulation of, let's say, fluids and dead cell parts and white blood cells, and it puts pressure on our nerve endings in the area, or the injury could have also nicked or damaged some type of art or nerve, causing that pain feeling that you sometimes get. In general, this is a non-specific um, way for the body to attack. So it is the same for anything that happens. A cut, a puncture from like a needle, an antibiotic, a bacteria, a virus, whatever it might be, a bruise, all those things, the body's going to have inflammation as a way to potentially stop that microbe from getting too far. Um, so again, this the biggest thing for inflammation for this exam is remembering the five signs. Oh, sorry, the four signs: rubor, calor, dolor, tumor. There's like one slide on this in Dr. Curley's notes. It has a bit of the details, but it's not too bad. And then understanding the chemicals that are involved. So histamine is released. That is involved in the vasodilation to make the arteries or the veins bigger to let more white blood cells or other cells to get to that area. And then bradykinin is an inflammatory chemical that actually triggers inflammation in that specific area. To then basically what we're trying to do is slow down or keep all of these blue little particles, I'll call them bacteria or microbes, from actually going anywhere else. Okay, so the immune system is divided into three layers of defense. You have your innate immune system, which is primarily your first and second line defense, and then you have your adaptive immune system, which is your third line of defense. The first line of defense is fairly simple. It is the body's attempt to keep foreign pathogens out of the body. So that is done with primarily physical and chemical barriers. So the physical barriers, the ones that you normally know of, skin, um, our respiratory tract is lined with mucous membranes. We have mucus, cilia, which is the little tiny hairs, coughing and sneezing. Our eyes can blink, and they also have a couple, they have eyelids, things like that, to kind of keep pathogens out of our eyes. The GI tract is also lined with mucous membranes and mucus, but it also has the ability to induce vomiting and diarrhea. And then the reproductive organs also have mucous membranes, mucus, and cilia or hairs to keep out foreign pathogens. For the most part, the physical barriers you've either experienced or you know of. Um, Yesterday in class, we had a couple people that were sneezing, had runny noses. Again, those are your first line of defense, trying to either sneeze out the microbe that's infecting you. Um, Mucus can trap microbes that are in your, let's say, respiratory tract, and then you can either again sneeze it out or cough it out or blow it out, or you can swallow it. And by swallowing it, you can take it into your stomach, where the stomach acid could potentially destroy the bacteria or the infection. And if for some reason that infection does like acidity, you can then move it over to the small intestine where it's an alkaline environment, and that'll typically kill bacteria or fungi that like the more acidic environment of the stomach. And then you have chemical barriers. Again, same thing on the skin. You have an acidic pH. You have your salts. You have your oils, the oily skin. All of that stuff helps to keep other microbes from either attaching or staying on our skin or surviving on the skin. And then the respiratory system, the eyes, the GI tract, use different types of enzymes, acids, and chemicals to protect us from outside invaders. Okay, so if for some reason this microbe's able to get through our first line of defense, the second line of defense, where your white blood cells start getting involved. Primarily for your second line response, you have uh, the neutrophils, monocytes, eosinophils, and basophils. And then you also have your NK cells or your hunter killer or natural killer cells, sorry. I'll cover what each of these does on the side, but essentially these white blood cells will try to kill microbes the same way. So what I mean by that is neutrophils. For Dr. Curley's class, he primarily focuses on how they kill bacteria, but neutrophils do also attack other things. Um, Basophils do not kill anything. They are just secretors of other chemicals like bradykinin and like heparin and histamine. which helps the immune system respond quicker. And then eosinophils are primarily used to help us kill parasites, and they're also involved in allergic responses. So if you have, seasonal allergies or allergic to bee stings or peanut butter, you can thank the eosinophils for that one. And the monocytes are inactive macrophages. So monocytes basically will circulate the body, and then if you have an infection, monocytes will differentiate into macrophages, which are big eaters, and their primary job is to essentially eat bacterial or microbial cell parts. And they'll eat until they die. Once they die, they can no longer function. They'll kind of burst, and then other macrophages will come up and eat up the leftovers. And then NK cells, these are Dr. Curley's favorite. They are essentially immune cells that um, do not need somebody to tell them what to kill. So they go through the body and they do this process of screening. They'll do so. Each of our cells have a flag, an antigen that tells the body that we are your cell, or that they are your cell, and that they are healthy or not healthy. So the NK cells just go around and check, are you healthy? Are you my cell? If you are, it just kind of leaves the healthy cell alone. If during the search it finds either cells that are yours but are not healthy, or cells that are not yours, then the NK cell goes through the process of just automatically trying to kill that infected cell, whether it's like a tumor cell, like a cancerous cell in our body, or something that's external, like a bacterial cell or something like that. So second line defense, the primary thing to remember, macrophages are involved in primarily phagocytosis, which is them eating other microbes. They also do a bunch of other cool things like trigger and fever, inflammation, and they are the ones that take a piece of a microbe, like a bacteria, and they show it to our third line of defense so that our third line of defense can start creating a specific or adaptive response to the infection. Neutrophils primarily are also involved in phagocytosis. Basophils are in the blood, and which you've also probably heard of mast cells, which are similar to basophils, are just found in our tissue. And they're primarily responsible for allergic responses, and they'll also secrete the histamine and the heparin to kind of trigger vasodilation and anticoagulation. Um, Heparin, or microbes like to cause our blood to clump up because it'll slow down our immune cells' reaction time. So heparin is very useful for our basophils because it keeps our blood from clotting so that you can get the white blood cells to an area of infection much faster. And like I mentioned before, eosinophils primarily are involved in parasitic infections, and they're also responsible for attacking allergies or allergic components, if you will. I'm going to skip this one because this one probably makes it a little easier. Okay, so our third line of defense is what we call the specific or adaptive immunity. Um, Depending on the type of infection that you have, your uh, third line of defense will call either on B cells or T cells to attack that infection. T cells primarily are used for attacking things like virally infected cells, so viruses, also cancer cells, whereas B cells typically attack invaders that we call outside of the cells. So anything that's like a bacteria, a fungus, a parasite, that's where B cells are involved. The biggest difference between the two is that T cells will directly target and kill uh, the infected cells, but the B cells do not kill anything. They only make antibodies, and the purpose of the antibodies they have four purposes. neutralization, complement fixation, agglutination, and opsonization. Neutralization, um, every pathogen has um, cell parts that help it, or not every pathogen, I'll say bacteria, fungus, etc. Those have cell parts that allow them to attach to our, let's say, our mucus lining or our respiratory cells, um, or to our GI tract, whatever. And it allows them to attach and then start dissolving our protective layers so that the bacteria could then start creating its infection and causing damage in our body. What neutralization does is it kind of blocks off those external cell parts so that the pathogen can't actually attach to our GI tract and it won't actually cause damage. Agglutination, so antibodies are kind of like Legos where they can kind of connect together. So let's say I have a antibody that can attach to two bacteria. Well, then another antibody can attach to that antibody and then bring in two more bacteria. And a third antibody can come in and connect to those two antibodies with two other bacteria. So the antigens are able to connect together and drag those bacteria or fungus together to make this large clump of antibodies and pathogen. And what that does for us is it makes it easier for our immune system to find where the microbes are, where the infection is occurring. It helps the macrophages eat that large chunk of food a lot better than trying to find the onesie twosie bacteria that are in our body. The other part is optimization. So antibodies um, are able to essentially release these chemicals that um, there's basically like food seasoning. So the seasoning or the chemicals that are being released by the antibodies will force the macrophages to want to eat them versus anything else the macrophage might be looking for. And the whole purpose of this is to, again, try to get the immune cells to where the infection is occurring. So you clump it all together and then you season it a little bit, and now you have a nice big lump of bacteria with antibodies that the macrophage will want to devour. Could just, taste so good. Complement fixation is something that Dr. Curley will cover, but essentially there are different chemicals that help um, that help the that help to destroy virally infected, or sorry, to help destroy bacterial cells or parasites or fungi. Some of the things that complement fixation does is it adds to the optimization, so it could add additional quote unquote seasoning to it. Some other complement fixation proteins can also create like little pores or barriers in a bacterial cell or a fungal cell to kind of cause it to rupture and then have the internal cell parts kind of leak out so that our immune system can then go and eat it up. Essentially, it's just like a backup. They just do a little extra. They do some of the same stuff that our B cells already do, our antibodies already do. It just helps to make the process a little bit faster. And then T cells. T cells are, like I mentioned, they directly attack foreign invaders. There's four different types. So the macrophage, like I mentioned in earlier, is what's called an antigen presenting cell. So it'll take a chunk of, let's say, the influenza protein that you got from the flu shot. It'll deliver that to the helper T cell. And it's like a mugshot. It tells the helper T cell, hey, this is what we're looking for. I need you to start putting up billboards, send out some social media posts, tell the body that this is the foreign invader we are looking for. The helper T cell then recruits all the cytotoxic T cells and lets them know this is the um, pathogen we're looking for. Start scouring the body to look for it. The helper T cells will then go through the body. They'll start screening just like the NK cells do. And if they find that microbe, it'll just destroy it. It'll use things called perforins and granzymes, which is not part of this class, but if you get to 205 or some higher level classes, you'll use that. But basically, it uses little tiny chemical bullets to rupture the cell and then cause the cell parts to leak out so that the macrophages can come in and eat it all up. Once the infection is over, you don't want the immune cells to continuously go through your body and take away resources from your body to fight the infection. Um, Dr. Haley doesn't cover it in this class, but fever is a big part of the immune response. Fever helps, the increase in temperature in your body helps the immune cells act faster and act quicker, and it also slows down foreign pathogens, but you don't want to have a fever going continuously. So we have regulatory or suppressor T cells that will direct the cytotoxic T cells to let them know that the infection is over, the fight's over, we won. You guys can stand down, and there's no need to keep a high fever, keep inflammation, or to keep just scouring through the body for this infection. We're done. And typically after that, the cytotoxic T cells will then typically get either recycled or they'll become inactivated because they've done their part of the job. The biggest thing about our third line of defense for both B cells and T cells is that they will create what's called memory cells. The memory cells will remember the mugshot or the piece of the influenza virus, whatever it got infected with, it'll remember that so that the next time you get infected by the same pathogen, the body doesn't have to go through the steps of second line, goes and destroys it. Macrophage grabs a piece, takes it to a helper T cell. Helper T cell tries to figure out what it is, then tells the cytotoxic T cells to attack, and all that other stuff. The memory's T cells will remember and immediately turn into cytotoxic T cells and start attacking that infection. So it makes your second infection and future infections a lot quicker. You'll have less symptoms because of it, because the body's already kind of skipping step two and just jumping onto step three while still having step two going and killing things. So it just makes our body able to learn and adapt from everything we've been infected with. Um, it's what's kind of what I like about the immune system and why I want to really focus on it for like my degree is, in theory, the immune system can learn how to treat and fight off every infection we will ever come into contact with. The biggest thing with infections is how severe is the infection and how long will it take your body to develop the third line defense against that infection. So there is a point where the body is so damaged by an illness or an infection that the immune system doesn't have time to build up a defense or doesn't have enough energy left to actually fight back. That's kind of where people that are immunocompromised or are going through things like cancer therapies, that's where they're most likely to get sick. We're exposed to the same infections. However, their immune system's already overworked or damaged or not quite capable of fighting off other infections. So if you sneeze on me, there's probably something in there that my body doesn't like, but my body will fight that off. For someone that is in a clinical setting or fighting cancer, already immunocompromised, that sneeze could potentially kill them because their immune system may not be able to defend itself fast enough before that thing occurs. Um, Things like getting the flu shot, if you do work in a hospital setting, you may not think you need the flu shot. And realistically, if you're a healthy individual, you probably will be okay. But you're not getting the flu shot for yourself. You're getting the flu shot for your patients that are already in the hospital because they are recovering from something, or they were injured or sick from something. So their body is already fighting another fight. The last thing you want to do is also sprinkle in some influenza and then have their immune system be overwhelmed by what's going on. One thing I did want to mention about this one, like I said, there's a lot of specifics here. This is mostly for my Bio 205 students, but I like to use the same slides because it does roll into their class. Biggest thing to remember for this one, though, is a T cells are used in what we call intracellular, cellular, or cell-mediated responses. Dr. Curley uses cellular and cell-mediated. Dr. Cotter's class uses intracellular and cell-mediated. Just know that you can be asked a question, and it could be asking you what cells are involved in a cellular response or a cell-mediated response or an intracellular response, and your answer would be the T cells. On the flip side, anything that's a B cell, you will be a humoral response, an antibody-mediated response, or an intercellular response. Just keep a close eye on these keywords, especially like intracellular and intercellular are very similar, but it's usually cellular versus humoral or cell-mediated versus antibody-mediated. That those words will let you know whether you are going to be using your T cells for the infection or your B cells for the infection. Another thing to note here, like I mentioned before, T cells, they target and kill the infected cells or the infection. B cells do not kill. They only release antibodies to block off the infection or the microbe and then to clump it together and then season it so that the rest of the body can then, primarily the second line cells, can then come in and attack it. And you don't need to know your antibody types for this class. Dr. Cotter does want the antibodies, and that's covered later. Okay, that's really all I have for y'all. If you only have to take one exam this week, then good luck. If you're taking the combo exam, I also wish you good luck. Take a look at the hematology focus session for that. Otherwise, if you have any questions, reach out. Um, for the focus session question to get credit, I just want you to tell me the difference. Um, in your own words, just tell me what the difference is between T cells and B cells. And that should be it. Thank you very much, and I'll see you all next week.